Bon vendredi tout le monde.
Hello,
We're
everyone.
headed into the first weekend of December, and in many parts of the country, the situation is very serious. Wednesday, Quebec reported a single-day record of new cases, and across the country, we're seeing numbers rise. The health minister spoke with her counterparts last night and assured them that the federal government will offer all support needed, especially in Alberta, where the numbers are rising alarmingly. Earlier this week, Minister Rideau had a bilateral conversation with Alberta Health Minister Tyler Shandro. We will do whatever is necessary to help all provinces and territories deal with these outbreaks and get this situation under control. Across the country, cases are too high and hospitals are filling up. And when hospitals fill up, everyone suffers the consequences, not just those with COVID-19. We all know healthcare workers who are tired, who are stretched out, who are doing overtime. Canadians with surgeries are getting canceled, and people can't visit their loved ones in hospitals when they do go into hospital. This is what's at stake. This is why we all need to do our part. Now is not the time to blame one another or point fingers. Now is the time for us to keep working together. Depuis le début de la pandémie,
Since the beginning of the pandemic, we have distributed hundreds of millions of pieces of PPE throughout the country. In the past few months, we've also distributed over 6.7 million rapid screening tests to the provinces and territories. We encourage them to use them to help protect the population. Now let's talk about the vaccine. On Wednesday, the UK was the first country to authorize the Pfizer-BioNTech vaccine. This is very encouraging news. While we continue to discuss with our colleagues internationally, here an independent review done by Health Canada is still underway. I can tell you that our teams are working extremely hard. It's important to make sure that this vaccine is efficient and safe for Canadians and that it does meet our standards. The analysis of a vaccine represents hundreds of thousands of pages of data. Supplementary resources have been allocated to this, and we are fast-tracking work in the field to make sure that we are ready with a distribution plan.
Health Canada's independent review of the Pfizer-BioNTech vaccine is ongoing, and regulators are working around the clock. Let's also remember that Canada's deal with Pfizer is just one of many. We also have agreements with 6 other promising vaccine manufacturers, including Moderna and AstraZeneca Oxford. The National Operations Centre is working closely with the provinces and territories every day. The centre will be managing and tracking the distribution of vaccines once they are authorized. Yesterday, Major General Danny Fortin briefed the media and talked about how military expertise will be key to our vaccine rollout plan. For the first vaccines that could be authorized for use, or for what we call Track 1, specific logistics will be required to keep the doses at very, very cold temperatures. The Canadian Armed Forces is already holding simulation tests of this distribution plan with a series of exercises and run-throughs. Freezers have been purchased and dry ice contracts for cold shipping are being put in place. When vaccines get authorized and shipped, we'll be ready. Protecting you and your family and defeating COVID-19 is our top priority. Every Canadian deserves to be safe, and that includes the seniors who helped build this country. We've seen over the past many months far too many terrible tragedies in seniors' residences. We need to do better for our parents, for our grandparents, and for elders across the country. Through the Safe Restart Agreement, the federal government has already provided $740 million to help provinces and territories address the immediate needs of vulnerable populations like those in long-term care. And this week, Deputy Prime Minister Freeland presented the fall economic statement in which we are committing up to $1 billion for a safe long-term care fund. This fund will help provinces and territories carry out infection prevention, improve ventilation, and hire staff or top up existing employees' wages. We are ready to keep doing our part for our seniors and for all Canadians. Cette semaine, nous avons présenté notre énoncé
This
économique
week,
dans lequel
we
nous avons mis
presented
quelque
our
chose
economic
bien au clair.
update, and something
Nous
was
voulons
made abundantly
aider les
clear.
provinces et
We
les
want to help
territoires
provinces
à
and
protéger les
territories
aînés dans les
to protect
établissements de
seniors
soins de longue durée.
in long-term care
Dans le
homes.
cadre de l'accord sur la
Within
relance
this
sécuritaire,
Safe
le
Restart
gouvernement fédéral
agreement,
a
the
déjà
federal
investi
government has already
740
invested
millions
$740 million to help to respond the immediate needs of vulnerable populations, such as those in long-term care.
En s'appuyant sur ce que nous avons appris suite au déploiement des forces armées
Following
canadiennes
what
ce
we've
printemps,
learned with the deployment
nous allons
of the
investir
Canadian Armed
jusqu'à
Forces in the
1
spring,
milliard
we will
dollars
invest up
dans le
until
fonds pour des
up to $1
établissements de
billion
soins de longue durée
in a safe long-term
sécuritaires.
care
Ces
fund.
fonds permettront
These
de
funds
faire de la
will
prévention
allow
d'infection,
for
d'améliorer la
infection
ventilation,
prevention, to improve
d'embaucher et de
ventilation,
bonifier des
to
salaires.
hire and to top up
Au sujet de la
wages.
prévention,
With regards to
j'annonce
prevention,
aujourd'hui
today I'm
investissement de
announcing an
1,8
investment of
million de dollars
$1.8 million,
qui permettra à 12
which will
équipes de
allow
recherche de
12
travailler en
research teams to
partenariat
work in
avec
partnership
différents établissements
with
de soins de
different
longue durée
long-term
afin
care
d'étudier les
organizations
mesures en place.
to study the measures in
Ces
place.
équipes pourront
These
alors faire des
teams will be
recommandations
able
qui
to make
aideront à mieux
recommendations
protéger
that
les
will help
aînés
to better
maintenant
protect seniors
et pour
now
l'avenir.
and into the future.
This morning, we learned that Canada's labour market gained another 62,000 jobs in November. This means 2.4 million Canadians have returned to work after they lost their jobs during the pandemic. We're making progress, but there's still much more work to be done. This is a tough time for everyone, and the small business owners at the heart of our communities are no exceptions. Those small business owners are our neighbors and our friends. They're incredibly hardworking, devoted people. They're there at the heart of our communities, there at the foundation of our economy. And this is a time where we need to be there for each other. We need to be there for everyone. Since the spring, the Canada Emergency Business Account has helped almost 800,000 small businesses right across the country. This program has made a real difference, and people still need this support. And that's why we are now expanding CEBA. Starting today, if they need it, eligible small businesses can access a second CEBA loan of up to $20,000 on top of the initial $40,000 that was already available to them. And again, $10,000 of this additional financing will be forgivable if repaid by the end of 2022. These measures will protect jobs, make sure the local businesses that we love don't have to close for good. So I'm calling on everyone to do their part. In this holiday season, it is a moment for generosity. Everyone's trying to care for their loved ones. Try and make sure you're also supporting local businesses and ordering takeout from local restaurants. Your local business owners are adapting, are getting creative, are figuring out ways to continue to serve you. So we need to do our part as Canadians to lean on each other, to be there for each other, and to support everyone as we get through this pandemic. Pour aider les petites entreprises à traverser cette crise,
to help small
nous mettons de
businesses
l'avant
weather
une
this crisis,
expansion
we
du
are
compte
going to
d'urgence pour les
expand
entreprises
the
canadiennes.
Canada
À
Emergency
partir
Business Account.
d'aujourd'hui,
As
les
of
petites
today,
entreprises
small
éligibles qui en ont besoin
businesses
pourront avoir accès à
that are
un autre
eligible have
prêt
access to a
allant
second
jusqu'à
loan,
20 000
going up
supplémentaires
to an extra
en plus du prêt de
$25,000 on top of the
déjà disponible.
$40,000 already
Encore une
available.
fois,
Once
de ce nouveau
again,
montant,
of
on
this new
compte
amount,
$10 000 de prêts
$10,000
à
will be
remboursement
forgivable
On a tous un rôle à jouer dans
as
la
long
lutte
as the
contre
loan
la
is repaid
COVID-19
before
et
2020.
ses
We all
conséquences.
have a role to
Pendant
play.
que vous commencez votre
As
magasinage
you
des fêtes,
start your holiday
pensez
shopping,
à aider les commerçants
think
du
of
quartier.
helping out and
On a
supporting
tous
local
des amis,
businesses.
des voisins,
We all have
des membres de
friends,
nos familles
neighbors,
qui
members of our
travaillent pour les
family
commerces locaux.
working hard for local businesses. December is a critical month for businesses throughout the country. For months now, they have been adapting to the situation. They've been creative in the way of providing for Canadians. Let's continue to support local businesses. Let us not forget local stores, local online businesses, and don't forget that the holiday season is a time for generosity, to be generous towards members of our family, our loved ones, but also we have to think about others, especially our vulnerable local businesses. We must help them to weather this pandemic. We need to continue our efforts to lean on each other, to keep our distances, wear a mask, avoid gatherings, and use the COVID Alert app. Up until now, over 5.6 million people have downloaded the app. In the following weeks, even if we don't feel like it, we're going to have to continue to follow the health authorities' guidelines. Lives are at stake, and we cannot allow ourselves to slow down our efforts.
Before we end today, let me take a moment to talk about our introduction yesterday of Bill C-15, legislation to implement the United Nations Declaration on the Rights of Indigenous Peoples. On this, I want to recognize Minister Lametti, Minister Bennett and their teams, but more importantly, Indigenous leaders and partners who have worked tirelessly for decades in the efforts that led to this legislation. Bill C-15 mandates the federal government, in consultation and cooperation with Indigenous peoples, to take all measures to ensure that the laws of Canada are consistent with the Declaration. This is a momentous step forward on the path of reconciliation as we work together to build a better Canada for everyone. Our government is committed to seeing this bill reach the finish line within our mandate, and I call on all parliamentarians to help make this a reality. Merci beaucoup tout le monde.
Thank you, Prime Minister. We'll now turn to the phone for questions from media. So one question, one follow-up. Over to you, operator.
Thank you. Merci. For questions, please press star 1 on your device's keypad. Pour des questions, faites étoile 1 sur votre appareil téléphonique. Première question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. Are you relieved to see that the Quebec government finally backed down on Christmas gatherings? Answer. I think that we are quite disappointed to see the rise in cases throughout the country, and we're going to have to be very careful during the holidays. We knew that it wouldn't be Christmas, a normal Christmas, and now we're going to have to try to connect differently with our loved ones and call those who are far away. It's going to be a difficult time, but I know that we will be able to continue to follow the public health guidelines, to continue to do what's necessary in order to lower the case rates throughout the country, so then we can arrive in the spring with as fewer losses as possible. Question. On another subject, on vaccines, one of the lead administrators of public health, Dr. New, said yesterday that the media shouldn't be obsessed by the delivery date of the first doses of the vaccine. I understand that Health Canada is still reviewing the approval of a vaccine. Do you have an idea as to when we could receive the first doses? And if you don't have the answer, how can you explain this to Canadians? Answer. The important thing is to be ready. To be ready when vaccines will arrive, when they will be approved, to be able to distribute vaccines throughout the country. That's exactly what we're doing. You saw yesterday, Major General Fortin was speaking about the logistical exercises throughout the country to make sure that the minute Health Canada is sure that the vaccines are safe, we will be able to begin the distribution effort. We will continue to do everything in our power to make sure that Canadians will receive vaccines as quickly as possible, but it's not just a question of knowing who will have quick access to a vaccine. The issue is to know when we're going to be able to vaccinate as many citizens as possible. This is why We are very fortunate to have many potential vaccines, many potential doses of vaccines per person, and much more than other countries.
Operator.
Thank you. Merci. Prochaine question. Mélanie Marquis, La Presse. À vous.
Question. Thank you, Mr. Trudeau. First of all, regarding Meng Wanzhou, who has been detained in Canada while awaiting this extradition case, the Wall Street Journal was saying on Thursday that the government is under discussion with Mrs. Meng so that she be authorized to return to China in exchange for some things. Could you specify, is Canada involved in these negotiations? And also, are you trying to ask for that two Michaels be freed in exchange? Answer. I'm not going to comment on these reports. Canada and Canadians know that our absolute priority is the safe return of the two Michaels.
I'm not going to comment on those reports. Canadians know well that our top priority is the safe return of the two Michaels.
Melanie?
Question. Mr. Trudeau, I'm going to step back from the habitual subjects. This morning, the New York Times published an investigation on Pornhub, and the headquarters is based in Montreal, and it talks about rapes and of minors. Senators have written to you asking that you take some measures against Pornhub, and you have not responded. Could you tell us more about this, and could you tell us what you are planning to do to act following this request? Answer. We're extremely concerned by violence against women, child pornography. We have all kinds of measures in place, and we will continue to work with security agencies to make sure that there is no sex trafficking of people in the country.
We are always extremely concerned with gender-based violence, with exploitation of minors, with child pornography. We're going to continue to work with police agencies and security agencies and all means possible to ensure that all Canadians are kept safe.
Thank you, Prime Minister. Next question, operator.
Thank you. Merci. Next question, Ben Andrews, Carleton University. Line open.
Will the government commit to a new timeline for ending long-term boil water advisories?
Ending long-term boil water advisories has been a priority for this government from day one. The fact that in too many Indigenous communities across the country, degraded infrastructure and lack of opportunities have led to decades, in some cases, of boil water advisories has long been unacceptable. We have moved forward on lifting close to 100 long-term boil water advisories, and in this recent fall economic statement, we are demonstrating further commitment to continue to accelerate the hard work that needs to be done right across the country with an extra $1.5 billion. There are situations in which COVID-19 has interfered with our ability to work hard to get these new installations in. But we're continuing to redouble our efforts because it is unacceptable that any Canadian across the country not have access to safe, clean drinking water.
Since 2015, we've been working extremely hard to put an end to long-term boil water advisories in Indigenous communities. Almost 100 have been eliminated, but a lot of work remains to be done. That is why, in an economic statement, we invested $1 billion or $1.5 billion extra to speed up this work. During the COVID crisis, we have had difficulty accessing some communities. This has brought forth some delays, but we are doubling our efforts. It's not acceptable that people in Canada don't have access to safe drinking water, and this is exactly what we're going to continue working on.
And a follow-up question, Ben?
Do you think the additional $1.5 billion will be enough to cover all remaining communities?
We're going to continue to work until these communities are properly served. We will do it as quickly as possible, and we will devote the necessary resources to do that. $1.5 billion more will make a further difference, but we will continue to do whatever it takes in order to end these boil water advisories for good.
Hello, Prime Minister. I'm Mike Blanchfield, Canadian Press. Going back to the Meng Wanzhou case again, I think we all understand you don't want to say anything that could imperil the two Michaels, but they are. Michael Kovrig and Michael Spavor will have been in prison for 2 years come this Thursday. Do you think it's time to look at fresh approaches on trying to solve this issue? And have you talked to Joe Biden directly about bringing a fresh perspective to the American prosecution of this case when he assumes power, to perhaps maybe reconsider whether or not they want to keep pursuing this extradition?
For almost 2 years, we've been working extremely hard to bring home these two Michaels. It is an absolute priority for the government. I won't be commenting on any of the recent reports.
En français?
For nearly 2 years, we have been working non-stop for the safe return of the two Michaels. We will continue our work, but as I said, I'm not going to comment on these reports today. Question, Laurence Martin, Radio-Canada. Do you hope that the two Michaels will be returned between now and the end of the year? Answer, we will continue to work extremely hard for the safe return home of the two Michaels. 2 years away is much too long to be imprisoned in China or anywhere. We will continue to do everything in our power to bring them back.
I think we're going to continue to work as hard as we possibly can to bring these two Michaels home. It's been extremely difficult for them, for their families and their loved ones. We will continue to stand up for Canadians in difficulty anywhere around the world.
David Aiken, Global News. Good morning, Prime Minister. On vaccines, I wonder if you could bring us up to date on discussions, federal provincial discussions on the allocation of vaccines. Tell us where First Nations will fit into this and whether you'll commit to publishing the allocation tables once you've come to agreement. And finally, when will you come to an agreement on that?
Dr. Tam will be releasing further information on the guidelines established by top experts across the country on prioritization. Obviously, we're going to be there to support and put as a priority the most vulnerable across the country. And we're establishing those guidelines, which include populations we've talked about already, long-term care residents, the elderly, Indigenous peoples. These are the priority lists that we've worked on all together, and it'll be to the provinces to apply those guidelines. On parle depuis plusieurs semaines.
For several weeks, we've been talking about priorities with regards to the most vulnerable people. They will receive the vaccines first. We also have spoken about the elderly, people in long-term care homes, frontline healthcare workers. These are priority people and also the Indigenous people. Dr. Tam will share further information on this afternoon. Know that we are working with experts. The experts will set out the priority groups, and then these principles will be applied by the provinces.
The e-petition sponsored by MP Derek Sloan has been controversial. You've probably heard about it. It's the #1 e-petition on the Commons website. 25,000 Canadians have signed this. So whatever you might think of that petition, that seems to me that the government of Canada and provinces have a big communications challenge about getting people to sign on to the vaccine. Is there going to be a budget for it? Can you talk about what plans will be in place to convince Canadians that taking the vaccine protects us all?
First of all, the work that Health Canada is doing to ensure that this vaccine is every vaccine that is improved is safe for Canadians is uncompromising. There are no corners cut. There are measures put in place to ensure that any vaccine we distribute to Canadians will be safe for Canadians. Canadians can have confidence in our medical professionals, in our scientists, in our researchers who are doing everything they can to keep Canadians safe, both from this pandemic and from other challenges as we move forward. It is extremely important that support for scientists and doctors and health professionals and local public health authorities continues to be shared. And that's why it behooves every parliamentarian to stand up for science, to support the work of our experts who are working extremely hard to keep Canadians safe.
Hi, Prime Minister. Tom Perry, CBC. India today called in Canada's High Commissioner to complain about remarks that you made about the farmers' protests in that country. There's warnings that you've damaged relations between India and Canada. I'd like to get your response to that.
Canada will always stand up for the right of peaceful protest anywhere around the world, and we're pleased to see moves towards de-escalation and dialogue.
Anything more? I mean, are you worried about damaging relations between India and Canada?
Canada will always stand up for the right for peaceful protest and for human rights around the world.
Prime Minister Kevin Gallagher, CTV National News. Alberta's asking for help, Red Cross, field hospitals, federal assistance. But during this pandemic, there's also been sort of a different approach taken by the province, leaning more on individual responsibility, pro-business type of stance. What sort of federal help is coming to Alberta, and will there be any conditions that might persuade the province to put more strict restrictions for public health measures?
The job of the federal government from the beginning has been to be there to support Canadians right across the country. We did that with income supports right away. We did that with supports for small businesses, including wage subsidies, commercial rent assistance, and now expanding the small business account, CEBA, with even more money for businesses that are struggling. We also did that so that public health authorities could find it slightly easier to make the difficult decisions on bringing in restrictions where needed. But every step of the way, our job has not been to direct the provinces or judge the provinces. It has been to be there to support them. And we will be there to support the people of Alberta, just like we're there to support people right across the country. Every step of the way, the position of the federal government has been, how can we help to the provinces and territories, and it will continue to be so. Okay. À chaque étape de cette pandémie, nous avions été là.
At each and every step of the pandemic, we have been there for Canadians. Since the beginning, with CERB, with the wage subsidy, with help to small businesses, with commercial rent assistance, we've been there for the youth, for seniors throughout the country, and we will continue to do so. A part of that was to help local authorities to make the decisions to limit some business activities or other activities, knowing that the federal government would be there to support them, to support those that had to limit or close. At each and every step, we were there. We were there to support provinces, to support citizens, not to judge people, to tell them what to do, but rather to assist with everything that they needed, and we will continue to do that. We are there to help, and we hope that we'll be able to do that. Thank you, everyone.
Good morning, everyone. Bonjour tout le monde. J'ai le plaisir ce matin d'être en compagnie de la ministre Haidou, ministre de la Santé, Madame Anita Anand, ministre de l'Approvisionnement et des Services publics Canada, la Dr Tam, ministre en chef de la Santé publique du Canada, ainsi que Dr Liu, administrateur en chef adjoint de l'Agence de la Santé publique du Canada. Tous mes collègues vont s'exprimer ce matin.
All my colleagues
Je vais
will
dire un mot
speak
rapide
this
sur
morning. I
une annonce
will
importante
have a few
au
words on an
sujet
important
du
announcement with
compte
regards
d'urgence
to
des entreprises du Canada. Le
the
fait
Canada Emergency
qu'aujourd'hui,
Business
les
Account,
entreprises
CEBA.
canadiennes
Today,
peuvent
Canadian businesses
obtenir
can
un supplément de
obtain
20 000
an extra
à ce 40 000
$20,000
qui était
in
disponible
addition to the
jusqu'à maintenant.
40,000
20 000
available up until now.
duquel 10 000 n'est pas remboursable sous certaines
10,000
conditions. Ce
is
programme important
forgivable
a
under
profité
certain
jusqu'à maintenant
conditions.
à 800 000 petites
800,000
entreprises canadiennes.
small
So a
Canadian
brief
businesses
word on
have
the
used CEBA.
important news this morning. Minister Freeland and Minister Eng want everyone to know that applications for the extended portion of CEBA, the Canada Emergency Business Account, these applications are now possible now. An addition of 20,000 additional dollars, 10,000 of them non-reimbursable under certain conditions. Up to now, 800,000 small businesses in Canada have benefited from this small business loan and grant support. So this being said, I would now be pleased to turn to Minister Haidou.
Thank you very much, Genevieve, and good afternoon, everybody. Following yesterday's presentation by Major General Fortin and Dr. Sharma and Dr. New, I held the 32nd Health Minister's call on COVID-19, and we talked about the ongoing collaborative work to ensure safe and coordinated rollout of vaccines, including the distribution of supplies and the logistics and general readiness. We also talked about efforts to contain the increase that we're seeing in the number of Canadians who test positive for the virus. Yesterday, Health Canada officials shared that they should be ready to present a decision on the first of the vaccine candidates within a week to 10 days. And today, the group of experts advising us on who should be prioritized for a vaccine will publish an update and further refinement to their work. And I want to thank them again in advance for their advice. Dr. Tam will speak a bit more about that in a moment. So things are coming together. Canadians can be very confident that when a vaccine is ready, Canada will be ready. And I encourage every Canadian to keep visiting the canada.ca/coronavirus website, where we'll continue to publish new information about COVID-19, as well as information about vaccine readiness. For those who use the WeatherCan app, if you're a user of that app, you can now access information about COVID-19 trends in your region through the app. Just update the app to see this new feature. And for those that don't have the COVID-19 app, please download it. It's another layer of protection for you, your family, and your community. Thank you, everybody. Please stay well.
Merci, Patty. I would now be pleased to turn to Minister Anand.
Merci beaucoup, Jean-Yves. Aujourd'hui, je vais faire le point sur les ententes que nous avons passées avec les fabricants de vaccins, ainsi que la contribution de services publics et approvisionnement Canada à la façon dont le Canada entend déployer les vaccins contre le COVID-19. As previously mentioned, Canada's rollout plan has 3 key components. This is the framework that I utilize when I think about our vaccine plans over the next weeks and months. There are 3 phases: regulatory approval, distribution, and administration. Turning first to regulatory approval. As everyone is aware, Health Canada continues to work diligently and expeditiously to ensure that any vaccine deployed in Canada is both safe and effective. Regulatory approval of the Pfizer vaccine, as Minister Haidou just mentioned, appears to be forthcoming. Rolling approvals for Moderna, AstraZeneca, as well as Johnson & Johnson are ongoing. Based on the best scientific data available to date, and on the recommendation of the Public Health Agency of Canada and the Vaccine Task Force, Canada is exercising options for an additional 20 million doses of the Moderna vaccine candidate. This will bring Canada's total allotment of this vaccine to 40 million doses to be delivered in 2021. Moving to distribution. Once a vaccine receives approval, the next step, of course, is distribution, which will be complex and is being actively managed by Major General Fortin as he explained earlier this week. Given the need to transport and store some vaccines at sub-zero temperatures, we have already established the capacity to store up to 33.5 million ultra-frozen and frozen vaccines at any one time. More freezers are on the way to further expand our storage infrastructure. Today, we are taking another important step forward to support the distribution component of Canada's rollout plan. I am pleased to announce that on behalf of the Public Health Agency of Canada, Public Services and Procurement Canada has awarded a contract to FedEx, Express Canada, and Innomar Strategies for an end-to-end COVID-19 vaccine logistics solution. Ainsi, dès que nous recevrons les premières doses d'un vaccin,
as soon as we will receive the first doses of a vaccine approved by Health Canada, FedEx Express Canada and Innova will participate in the efforts deployed by the Government of Canada in order to distribute this vaccine to the population.
Canada will support the physical distribution of vaccines to provincial and health authorities or points of administration across Canada. Innomar Strategies fournira divers services, dont des
will provide different services,
de transport et de
stocking, transportation, and physical distribution in order to allow us to ensure rapid administration of a vaccine against COVID-19 approved throughout the country.
Moving finally to administration. Administration of the vaccine will be a monumental task led by our provincial and territorial counterparts. Of course, federal support is being provided throughout this process, including via the purchase of syringes, needles, gauze, swabs, and other equipment. We now have enough supplies to administer nearly 25 million doses of a vaccine, and more is on the way, including syringes, needles, alcohol swabs, wipes, and bandages. This is a process, of course, that began many months ago, and we are putting in place the final pieces. To close, from the very beginning and throughout this pandemic, we have been focused on keeping Canadians healthy and safe. Lorsqu'un vaccin sera prêt,
when a vaccine will be ready, Canada will also be ready.
When a vaccine is ready, Canada will be ready also. Merci beaucoup, Megwetch. Thank you.
Merci beaucoup, Anita. Dr. Tam.
Thank you, Anita. Dr. Tam.
Good afternoon, good day, bonjour à toutes et à tous. There have been 396,270 cases of COVID-19 in Canada, including 12,407 deaths. Nationally, there are 69,255 active cases across the country. And over the past week, laboratories across Canada have tested an average of about 74,600 people daily, with 7.4% testing positive. The national average case count is now close to 6,200 cases reported daily over the last 7 days. With continued rapid growth of the epidemic over many weeks in a growing number of health regions across Canada, the troubling rise in the number of people experiencing severe illness continues. Over the past week, there have been on average close to 2,500 individuals with COVID-19 being treated in Canadian hospitals, including almost 500 in critical care, and 87 deaths reported each day. The latest longer-range modeling forecasts say that if we stay on the same trajectory, we could reach 10,000 cases daily by January. The progression of the COVID-19 pandemic has been filled with difficult news, as rapid epidemic growth continues and high infection rates are affecting more and more health regions. The impacts of ongoing community spread are increasingly being felt in high-risk populations and settings, including long-term care homes and hospitals. But these impacts affect everyone, as our health workforce and health system bear a heavy strain and must cancel or postpone important elective medical procedures, adding to pre-existing backlogs. Good news cannot come quickly enough. So I want to talk about some good news, though not losing sight of the challenges we still face. Canada is well positioned to provide access to safe and effective COVID-19 vaccines for all Canadians, and an initial supply of vaccine is expected to become available in early 2021. We know that supplies will be limited at the outset. Therefore, Canada's National Advisory Committee on Immunization, or NACI, has released its latest guidelines, providing further recommendations for the initial sequencing of key populations for early COVID-19 immunization. NACI recommends that initial doses of authorized COVID-19 vaccines should be offered to residents and staff of congregate living settings that provide care for seniors, adults 70 years of age and older, beginning with adults 80 years of age and older, healthcare workers, including all those who work in healthcare settings, and personal support workers whose work involves direct contact with patients, adults in Indigenous communities where infection can have disproportionate consequences. The federal government is working hard with provinces and territories on Canada's COVID-19 vaccine rollout, informed by public health, scientific, and medical experts, including NACI. A successful pandemic immunization response requires us to continue working together with trust and understanding towards a common goal. I recently read a quote that captures this perfectly. Public health moves at the speed of trust, by Dr. Rishi Manchanda, member of the U.S. Community-Based Workforce Alliance. This reminds us that our success against COVID-19 will only work with the confidence, trust, and cohesion of all Canadians. We don't have a vaccine just yet, and we must be prepared to address a range of logistical and operational challenges. But one thing is assured: any and all COVID-19 vaccines approved for use in Canada will be required to meet the highest standards of quality, safety, and effectiveness set by Canada's rigorous regulatory review process. We are committed to sharing new information as it becomes available. Let's keep the dialogue open. Thank you.
Bonjour à toutes et à tous. Il y a eu
Hello, everyone.
396 270 cas de COVID-19 au Canada, dont 12 407 décès. À l'échelle nationale, il y a 69 255 cas actifs. Au cours de la dernière semaine, les laboratoires de toutes les régions du pays ont analysé les tests de dépistage d'environ 74 600 personnes par jour, dont 7,4% ont reçu un résultat positif. Près de 6 200 cas en moyenne ont été signalés tous les jours à l'échelle nationale au cours des 7 derniers jours. La croissance rapide et soutenue de l'épidémie observée depuis de nombreuses semaines dans un nombre grandissant des régions sanitaires du Canada s'accompagne d'une augmentation inquiétante du nombre de personnes gravement malades. Au cours de la dernière semaine, près de 2500 personnes atteintes de la COVID-19 ont été traitées en moyenne dans les hôpitaux canadiens, dont presque 500 se trouvaient aux soins intensifs. De plus, 87 décès ont été signalés en moyenne chaque jour. Selon les dernières prévisions à long terme établies par modélisation, et si la trajectoire de la courbe se maintient, le nombre de cas quotidiens pourrait atteindre 10 000 d'ici janvier. Les nouvelles au sujet de la pandémie sont difficiles à entendre, car l'épidémie continue de se propager rapidement et de plus en plus de régions sanitaires enregistrent des taux d'infection élevés. Les effets de la transmission communautaire continue se font de plus en plus sentir dans les populations et les milieux à haut risque, notamment dans les établissements de soins de longue durée et les hôpitaux. Mais ces efforts ne touchent tous,
But
car les travailleurs de la santé et
these
le système
impacts
de
affect
santé
everyone,
sont sous
as
forte
our health
pression
workforce and
et
health
d'importantes
system bear a
interventions
heavy
médicales
strain
non
and
urgentes
must cancel
doivent être
or
annulées ou
postpone
reportées,
important
ce qui
elective
accroît
medical
les arrières
procedures,
préexistants.
adding to
Les bonnes
pre-existing
nouvelles se font
backlogs.
attendre.
Good news
Nous
cannot come quickly
souhaitons
enough.
donc vous parler de
So I
ce
want
qui
to
va
talk
bien,
about some
sans
good
perdre
news,
de vue les défis
without
encore devant
losing
nous.
sight of the
Le
challenges we
Canada
still
est bien
face.
placé pour fournir à tous les
Canada
Canadiens
is well
l'accès à des
positioned to
vaccins
provide
sûrs et
access
efficaces
to safe
contre la
and effective
COVID-19 et
COVID-19
une première
vaccines for
quantité de
all
doses
Canadians,
devrait être
and an
disponible
initial
au
supply
début
of
de
vaccines is
2021.
expected to become
Nous savons que
available
le
in
stock
early
sera limité au tout
2021.
début.
We know
C'est
that
pourquoi le
supplies will be
Comité
limited at the
consultatif
outset.
national de
Therefore,
l'immunisation, ou
Canada's
CCNI
National
du Canada,
Advisory Committee
a
on
publié ses
Immunization, or
dernières
NACI,
orientations
has released
qui
its latest
contiennent d'autres
guidance, providing
recommandations
further
sur l'ordre
recommendations
initial
for
de
the initial
vaccination
sequencing
des principales
of key
populations à
populations for
immuniser en
early
priorité contre la
COVID-19
COVID-19.
immunization.
Le CCNI recommande que
NACI
les premières doses de
recommends
vaccins
that initial
homologués
doses of
contre la
authorized
COVID-19
COVID-19
soient
vaccines
offertes
should be
aux
offered
résidents et
to
au personnel des établissements
residents and
collectifs
staff
de
of
soins
congregate
aux
living
personnes
settings
âgées,
that provide care
aux
for
adultes de
seniors.
70 ans ou plus,
Adults
en
70 years
commençant
of
par
age
ceux
and
qui ont
older,
au moins
beginning
80
with
ans,
adults 80
au
years of
travers
age
de la
and older.
santé, notamment
Healthcare
à tous les
workers,
employés des
including all
établissements de
those who
soins de
work in
santé
healthcare
et aux
settings
préposés au
and
soutien à la
personal
personne
support
qui sont
workers
directement en
whose work
contact
involves
avec les patients
direct contact with
et
patients,
aux adultes dans les
and
communautés
adults
autochtones
in
où
indigenous
l'infection pourrait
communities
avoir
where
des conséquences
infection can have
disproportionnées.
disproportionate
Le gouvernement
consequences.
fédéral travaille fort
The federal
avec les
government
provinces et
is
les
working
territoires
hard
pour
with
établir un
provinces
plan
and
de
territories
distribution des vaccins
on Canada's
contre la
COVID-19
COVID-19 au Canada,
vaccine rollout,
avec l'aide des spécialistes
informed
de la
by
santé
public health,
publique et d'experts scientifiques
scientific,
et
and
médicaux,
medical
notamment
experts,
du Comité consultatif
including the
national
National
de
Advisory
l'immunisation.
Committee on
Pour
Immunization.
assurer le succès de notre campagne de
A successful
vaccination, nous
pandemic
devons
immunization
continuer de
response
travailler
requires us to
ensemble
continue
vers un
working
but commun
together
en faisant
with
preuve de
trust and
confiance et de
understanding
compréhension.
towards a common goal.
Nous avons récemment lu une
I
citation
recently
de
read a
Dr.
quote
Rishi
that
Manchanda,
captures this
membre de
perfectly.
la Community-Based Workforce Alliance des États-Unis,
Public
qui
health
illustre
moves at the
parfaitement
speed
cette
of trust
réalité.
by Dr. Rishi
La santé
Manchanda,
publique
member of the
progresse
U.S.
au même rythme
Community-Based
que la
Workforce
confiance.
Alliance.
Cela nous rappelle
This
que nous ne
reminds us
pourrons
that
venir
our
à bout de
success
la
against
COVID-19
COVID-19
que si la
will only
confiance et la
work with the
cohésion
confidence,
règnent chez tous les
trust,
Canadiens.
and cohesion of all
Nous n'avons
Canadians.
pas encore de vaccin et nous
We
devons
don't
nous
have a
préparer
vaccine
à
just
relever
yet,
toute une gamme de
and we must
défis
be
logistiques
prepared
et
to address a
opérationnels.
range of
Mais une
logistical
chose est
and
certaine,
operational
tous les vaccins
challenges.
contre la COVID-19
But one thing is
homologués au
assured,
Canada
any and
devront
all
respecter
COVID-19
les normes
vaccines approved
élevées
for
en
use in
matière de
Canada
qualité,
will be required to meet
d'innocuité
the
et
highest standards
d'efficacité
of quality,
établis dans le
safety,
cadre
and
du
effectiveness
processus
set
rigoureux
by Health
d'examen
Canada's rigorous
réglementaire de Santé
regulatory
Canada.
review process.
Nous nous engageons à vous
We are
fournir des
committed
nouveaux
to
renseignements
sharing new
dès que
information
nous en aurons.
as it becomes
Poursuivons
available.
le dialogue.
Let's keep the
Merci.
dialogue open. Thank you.
Thank you, colleagues. We would now be pleased to answer questions.
Bonjour, nous allons commencer par les questions au téléphone. Pour 3 personnes, nous allons prendre une question plus une question de suivi. Un rappel que lorsque vous demandez pour une précision, c'est considéré une question de suivi. We will start on the phones with questions for one question and a follow-up. As a reminder, when you ask a precision, that is a follow-up. We are looking to go until 1:15 today. So we will start on the phone with 3 questions. Opérateur.
Merci. La première question est de Catherine Lévesque de la Presse canadienne. À vous la parole.
Oui, bonjour. Je vais poser mes questions
Hello,
en
I'm going to
anglais.
ask this
First
question
of all,
in
Dr.
English.
Tam, so we understand there's now a refined list of people who will be vaccinated. First, I was wondering how many people are in these categories? Do you have a number, considering that you said there will be only 6 million doses? Thanks.
Yeah, so ultimately, vaccine programs are delivered by provinces and territories, but through the Special Advisory Committee, and one of the key committees that we work with on a regular basis, the Canadian Immunization Committee, there's been estimates made of the numbers in each of these groups. And the information or the recommendation from the National Advisory Committee on Immunization on the very initial sequencing takes into account the numbers being provided. So, but in the end, the provinces and territories will be the ones actually doing the very specific planning. So you can imagine, say next year, Q1, first month, depending on how many doses arrive at that time, they will be sequencing on the ground the populations that they can vaccinate. Of course, we're also working potentially initially with 2 vaccines and provisionally working with an amount of 6 million doses or 3 million people. So these are the sort of planning parameters that was looked at when this initial group of key populations were recommended.
So as a follow-up, I just want to make sure I understand that this refined list, I understand those are guidelines, but I guess 6 million doses, will that be enough to cover all of these people in the refined list, including seniors 80 years and older, health workers, and indigenous populations?
So I think that's in the range of what could be covered by 6 million doses. There are assumptions that have to be built in about vaccine uptake. You have to build in also a small amount of wastage that might happen in immunization programming. So there's different assumptions being built in, but as a ballpark, these 4 groups of people, as things are rolled out, should be covered by the initial doses. But I just have to caution that given there's so many different parameters and uncertainties, we just have to be prepared for unexpected things to happen, deliveries, etc. But I think the bottom line to your question is that those 4 categories were informed by an assumption that we will get 6 billion doses.
It's Dr. New. Maybe I can just add to that. I think, as Dr. Tam mentioned, all 6 million doses in the first quarter won't be arriving all at once. They'll be coming in sort of irregular shipments. And so certainly what's going to happen in the provinces and territories is that there'll be vaccinating individuals throughout the course of those first 3 months as those 6 million doses get shipped at regular intervals. And of course, then I guess what we anticipate is that we will get many more millions of doses if all goes well with the contracting and approvals in, quote, the second quarter. So in some ways, it's quite seamless. Like we just continue vaccinating all these groups, and so we'll have enough for everyone because there's nothing magic that happens between the end of March and beginning of April. These shipments will be coming, and more doses will be coming, and those groups will be vaccinated, as well as hopefully getting more doses so we can offer access to other Canadians as well. Thank you.
Thank you. Operator, next question.
Thank you. The next question is from David Atkin from Global News. Please go ahead.
Thank you very much. Hope you can hear me. I'm in my car right now. I've got a database question. And I wonder if maybe Dr. Tam, maybe Minister Rideau. It's important, obviously, that people who get the first dose of a Pfizer don't get a second dose of the Moderna, that people are tracked between jurisdictions and health units. So can you talk about the database and information technology challenge to track recipients to make sure they get the right dose at the right time and aren't switching between vaccines? Who's managing that?
This is Teresa Tam. I'll take that question. So we are, of course, in the process of very detailed planning right now, and that was probably addressed yesterday at the technical briefing. Right now, as everyone knows, immunization programs are delivered by provinces and territories. They do have registries and databases, but we are now certainly looking at how do we augment that existing platform. But just to be clear that, there are existing systems and registries in the different provinces, but we are looking at further support as needed for the reasons that you just essentially laid out. We want to be able to track doses as they arrive, as they go into the different points of use, and then making sure that the individuals get the same vaccine. So that work is underway.
Thank you. And next question is a question I just put to the Prime Minister, and I wonder maybe I could maybe put it to Minister Haidoo, I guess, on this one. And that's this issue. It's about the Sloan-sponsored petition, the Derek Sloan's petition. Whatever one might think of some of the mistaken assumptions beside that petition, 25,000 people have signed it. It's the most popular e-petition in the House of Commons. And that seems to me that there's a major communications challenge for the government. So, Minister Haidoo, what is the government and the provinces doing to talk to people, to tell them, take this vaccine? Is there some funding set aside? Can you speak to that, please?
Well, thanks. First of all, I'll speak to the petition as I understand it, which is being sponsored by MP Sloan. And it is a petition that's being organized by an anti-vaccination group. It's full of misinformation, it's full of unscientific information, and it is extremely fear-driven. And it's unfortunate to see politicians utilize their power to provide misinformation to Canadians when what Canadians need is clear, concise, science-based evidence-based information. And so the Government of Canada continually works against misinformation from the beginning of COVID-19. This isn't the first time that we've seen this, in particular from the opposition party. But we work as a government to provide credible information in a variety of different ways, web-based, through media campaigns. We've got a host of information on a regular basis going out to Canadians in a variety of different ways. Vaccine hesitancy is real. And certainly I would hope that elected officials would not contribute to people's fear of science-based public health advice and guidance. And the final thing I'll say is this is why it's so important to have independent health regulators. It's important for the confidence of Canadians to know that politicians are not the ones making decisions about whether or not vaccines are safe or whether or not drugs are safe, whether or not medical equipment is accurate enough. We've seen a number of those kinds of fights as well. And in fact, it's why I, as health minister, have so guardedly protected the independence of the health regulators, because Canadians depend on knowing that whatever is reviewed by Health Canada regulators, it will be done through the lens of science and not influenced by politics whatsoever. So I would encourage all Canadians to stay informed using local, provincial, or national public health guidance and sources, and certainly we'll continue our work to communicate with Canadians every step of the way.
Merci. Opérateur, prochaine question.
Merci. Notre prochaine question est de Émilie Bergeron de l'agence QMI. À vous la parole.
Oui, bonjour. Pour revenir aux recommandations du comité consultatif
to the
sur
recommendations made by NACI, I understand that we have 4 initial categories. It's a shame that the National Advisory Committee is not here in person to explain why they made these choices. So we have 4 categories, and this does include a lot of people.
En quoi ça va limiter les choix qui doivent être faits?
How is this going to limit choices?
Merci pour la question. C'est Dr. New. Oui, comme vous avez précisé, notre comité consultatif national de l'immunisation a pu préciser les groupes, peut-être on peut mettre en priorité pour immuniser avec les premières doses on va recevoir. Bientôt. Ce que je peux vous dire, c'est que les recommandations des experts indépendants de l'agence, c'est vraiment basé sur les données probantes et l'évidence scientifique. Et c'est aussi parce que le but, c'est toujours de minimiser la morbidité et mortalité au Canada. De la COVID-19 et on a vu qu'est-ce qui se passait au printemps, même au Québec, avec des CHSLD. Donc, avec les recommandations, on prend ça à l'agence et maintenant, on est en train de discuter avec nos homologues, avec le comité consultatif spécial qui comprennent tous les médecins hygiénistes en chef de toutes les provinces et territoires, parce que maintenant, on sait que c'est les provinces et territoires qui sont responsables pour vraiment la vaccination de leur propre population dans leurs administrations. Ce que je peux vous dire, c'est oui, on attend maintenant, c'est après l'approbation des deux vaccins, on attend de recevoir 6 millions de doses. On a aussi des estimés pour le nombre de personnes dans des groupes ici, peut-être dans les groupes prioritaires. Et c'est aussi une question de planifier et aussi de logistique. Si on reçoit les 6 millions de doses dans le premier trimestre, ce n'est pas tout un coup. C'est vraiment au fur et à mesure. C'est peut-être une livraison peut-être toutes les semaines. Donc, c'est les provinces et les territoires qui vont commencer à vacciner leur propre population peut-être prioritaire, mais avec un horaire qui prend en considération les aspects logistiques. Et on attend aussi plus de millions de doses dans le deuxième trimestre, mois d'avril et après. Donc, je pense que c'est comme une horaire de vaccination qui va continuer. Ce n'est pas quelque chose seulement pour le premier trimestre et puis le deuxième trimestre. C'est quelque chose qui vraiment, on commence peut-être un peu lentement, mais puis après, ça va continuer avec vraiment plus de vitesse, avec plus de doses qu'on en attend dans le deuxième trimestre. Donc, je pense que c'est important d'assurer les Canadiens, oui, on commence avec les 6 millions de doses, mais tous les groupes prioritaires vont avoir l'accès au vaccin, et puis après, aussi tous les Canadiens. Merci.
Oui, et vous venez de mentionner 1 million de doses.
You mentioned 1 million doses in the second quarter?
J'ai dit plusieurs millions. On attend plusieurs millions. Je ne peux pas un chiffre exact.
I don't have an exact number
je ne peux pas préciser, mais ce que je comprends avec les discussions avec les compagnies, peut-être le ministre peut mieux préciser, mais ce que je comprends avec les contrats, tout ça, on attend plusieurs millions de doses aussi pour le deuxième trimestre.
Merci.
Merci. Nous allons maintenant passer aux questions dans la salle pour 3 questions. We will now come to the floor for 3 questions.
Hi, could I get some clarification on some of the guidance and also on the federal government's position in terms of how the vaccines ought to be distributed to provinces? If you're still negotiating with provinces, whether it should be per capita or on some other basis based on perhaps epidemiology, like you said yesterday, Dr. New, what is the federal government's position? If you're still negotiating, you have a negotiating position. Do you believe as a federal agency that it ought to go out on a per capita basis, or it ought not to go out on a per capita basis, but on some other basis? And what is that?
Thank you for the question. I think every step of the way, what we've been there to do is to support provinces and territories to deliver on their healthcare responsibilities. And that means that we work with provinces and territories, first of all, to assess what their perspective is and how they would like to distribute amongst the provinces and territories and across the country. I can tell you those conversations have been extremely collaborative. In fact, I've been involved in these conversations on personal protective equipment, on testing distribution, and the work is done first at the officials level and then done at the health minister's table. And they are conversations that are based on people's perspectives, obviously, need, and obviously there's a federal role to play in protecting a certain amount of product, whether we're talking about vaccines or personal protective equipment for federal populations that we're responsible for, as well as for urgent situations. And these conversations are proceeding just as collaboratively.
What is the percentage of the population you would like to see covered by a vaccine overall, in order to determine that you've had a successful vaccination campaign and immunity is broad and widespread in the population? And if Dr. New, you could clarify, yesterday you said you anticipated, you're planning for a possible only 75% utilization rate and a 5% spoilage rate. So does that mean that you're only expecting that, you're not expecting the full 3 million people or 6 million doses to be used? What portion then won't be, and why?
So as with all immunization programs, as province and territory do the detailed planning, you will look at, well, how many people do we offer this vaccine to? How many people do we say show up, our clinics? So with that, you take into account some sort of assumption on the uptake. So that's just for planning purposes. You can't actually tell, until you got the immunization program going as to what the eventual uptake is. But just for planning purposes, we know that routine immunization is, like 80% to, somewhat higher for some of the childhood vaccination. So this is just to take into account what we know in general is the uptake from Canadians. Of course, there are polls and surveys being done on a regular basis as well. So those are taken into account as to how many people of that group may show up. So you can offer it to more people. If you think about it, it's 3 million, so 6 million doses, maybe it's not 3 million people. You would go out to say 3.5 or 3.8 million people to offer them the vaccine, and then the number of people would then show up. So that's just for that, the planning purposes. So with, I'm trying to remember your first question, sorry. That's right. So the data from each of the vaccines is still going to be monitored. So the phase 3 clinical trials, as it comes through the regulatory review, will also be provided to the National Advisory Committee on Immunization. So the regulator will ensure safety, efficacy, quality, risk and benefit. The benefit outweighs the risk. The National Advisory Committee on Immunization will then take the scientific data that is available then to make some more specific recommendations. At the beginning, and certainly the data that will be available, is going to be mainly focused on personal protection. So the clinical trials is going to say it's going to be effective X%. We heard some good news, they seem to be like the 90% mark or over for the initial vaccines for different age groups. So we'll look at that, but that's really for personal protection. When you protect a person, you have to look at the different endpoints. Are you protect them against illness, which is what some of these endpoints are? Are you protecting them against serious illness? Again, some of this data is going to be available. Does it reduce transmission? Well, I think that if you prevent someone from getting the infection, for example, it's likely to prevent onward transmission. And so we would expect that as we roll out the vaccine program, those effects will need to be measured and looked at. Finally, nobody actually knows the level of vaccine coverage to achieve what might be called community immunity or herd immunity. We have an assumption that you would probably need about 60 to 70% of people to be vaccinated. But we do not know that actually for sure. There's modeling, there's different experts coming in. The dispersion of this virus, the way it spreads is sometimes a little unusual with, most people don't spread to a lot of people, and then all of a sudden you get super spreading events. So lots of these calculations are being done, but the bottom line is we actually don't know, but we make an assumption for planning purposes. In the end, though, as our ministers have said, we've actually have enough of the arrangements for all Canadians who want to be vaccinated to receive the vaccine. So that is the actual goal. As many as Canadians, as fast as possible for safe and effective vaccine. Thank you.
Merci. Prochaine question. Next question.
Hello, Mackenzie Gray from CTV News. This is for Minister Anand or Ms. Rideau. On Tuesday, I think, Jason Kenney said that Alberta is going to receive vaccine doses as soon as January 4th. Can either one of you confirm that that date is correct?
Thank you so much, Mackenzie, for the question. And indeed, I do believe that General Fortin, the Public Health Agency of Canada, have been in touch regularly with the provinces and territories for scenario planning purposes, and that they have put different timeframes for planning purposes in front of the various jurisdictions. From a procurement standpoint, however, we are not working with a January 4th date in particular. We are working with a time frame, as I've continually said to you and others, of Q1 2021. We are in touch with our suppliers each and every day to negotiate as early as possible within that time frame, and we are very hopeful that it will be in the January time frame. But of course, I will continue to update you and the Canadian public as we move further towards specifying that date. Thank you.
I do. Okay, Dr. Tam and Dr. Nim, my follow-up is for you. Obviously, the efficacy numbers from the Moderna and the Pfizer vaccine are very positive in the 90-plus range. But one of the things when I've been looking at that, and I'd like your opinion on this, is that many of the people who participated in the trial, despite the fact that it's very large, were under stay-at-home orders for points of time, were wearing a mask, were potentially social distancing. So were you confident in the 90% number, and could you envision it coming down once restrictions are lifted and we start seeing people interacting like we normally would?
So I think first of all is that data needs to be examined closely. I have not seen the data, and it will be reviewed by Health Canada and also by the National Advisory Committee on Immunization. There's a range of age groups, for example, that is included. We need to know how many people and, sort of unpack that data as well. And in clinical trials of the magnitude that we're talking about, you're comparing those who receive the vaccine, those who receive the placebo, and then they are exposed. You assume that the exposure in a certain population is similar. So these clinical trials are done in different countries as well. And so I think, all of that will need to be taken into account. But your point is actually very important because on the ground, effectiveness, finally, of any vaccine depends on a whole host of factors. So we actually need to monitor what we call real sort of experience on the ground for vaccine effectiveness. That's the same with any vaccine, by the way. Something that is in a very controlled clinical trial situation, where they may have control for these factors, by the way. I don't know. We have to look at some of this information. Is that in real life, that is maybe not true. And so you then have to measure what that is in the Canadian context. And that needs to be done as the vaccine is rolling out.
Yeah, Dr. Yu, just to sum up, that's exactly the difference between what we term in sort of medical and public health terminology, the difference between efficacy and effectiveness. So efficacy is sort of how well the vaccine works in very controlled conditions, a clinical trial with the groups being studied and monitored very closely. And effectiveness is how well it actually works in the real world. And as Dr. Tam just said, that certainly for vaccines in general and with the real life experience, we understand and appreciate that the effectiveness is usually a bit lower than the efficacy of what you might find for a vaccine under very controlled conditions. Thank you.
Hi, I'll just go quick. I'll just ask one question so my other colleague can get one as well. What can you tell us about the effectiveness of the vaccine for elderly people, the ones that are expected to be approved? How effective will the Pfizer vaccine be among those elderly populations that are being prioritized?
So again, we have to see the actual data. And for the Pfizer vaccine, our understanding is that the efficacy, the clinical trials were done in persons 12 to 85 years of age. So then we can look at the vaccine effectiveness in the older age group. Based on what we know that's been communicated, there's for those who are 65 years of age or older, there was a 94% efficacy. And as to whether you can unpack the further age groups, we'll have to look at the data, but it seems to be pretty good for 65 years of age and older, as it's just, and it was 95%, I think, overall, but 94% in adults 65 years of age and older. And so then we then, of course, have to look at the Moderna vaccine as well, which showed also very high effectiveness for 18 years of age and older. So I think as the data becomes available, we can sort of communicate that more in terms of the older population, but it's looking promising.
Minister Haidoo, you mentioned today that you're concerned about misinformation and people getting the wrong impression from certain things, but your government has multiple times now been accused of not providing information to Canadians. The premiers are the ones who are telling us how many doses Canada is getting. The premiers are the ones giving us the dates. And you yourself, when you've been asked these questions, have either ignored them or not answered them, only to be confirmed many days later. Do you not then bear a responsibility to fill this void with actual information instead of just accusing people of feeding in misinformation?
Well, to be clear, I wasn't speaking about premiers. I was speaking about a particular member of parliament who has sponsored a petition that is full of misinformation and is not helpful in terms of inspiring confidence in Canadians to believe in science and public health measures. But in terms of the vaccination process, in fact, there are many moving parts, as we have outlined in the number of tech briefings that we've been providing to Canadians and to the media. Certainly, we are committed to continuing to come in front of the media and share with Canadians details as they become available. There are many conversations happening at many levels. Officials have been working on vaccination together since May, not just on the distribution, but on the readiness. As Minister Anand outlined, it's not just obviously the acquisition of vaccines, it's making sure that we have the product that we need to provide those vaccines, and we've been working with provinces and territories to ensure they have things like needles and gauze and bandages, etc. Making sure that provinces and territories have their own plans in place so that they're ready to receive these very difficult shipments, and that work is happening as we speak. So I reject the assertion in your question that we haven't been transparent with Canadians. In fact, as soon as we get information, we share it with Canadians. And I would encourage all Canadians to visit the canada.ca/coronavirus site, where we will be on a rolling basis providing more and more information on granular details of vaccination as those are finalized with provinces and territories.
And I might just add to that as well. Thank you, Patty, for that response. From our part, from public services and procurement standpoint, and in terms of our contracts, there are a number of moving variables, issues that relate to the clinical trials, issues that relate to the timing of the regulatory review process, issues that relate to the supply chains for each of the vaccine developers. It's within that bulwark of uncertainty that we are negotiating delivery dates. And as soon as we land on the firm delivery dates in Q1 of 2021, we will be as transparent as possible. There are a number of moving parts occurring simultaneously in this monumental effort to undertake a national vaccination program with vaccines that have not yet been approved. And it's important for us all to realize that that is the environment that we are working with, and we are working to provide information as quickly as possible to Canadians as it arrives. Thank you.
Merci. Il est présentement 13h15. Ceci met fin à notre conférence de presse. We have now come to the end of our press conference. Thank you to everyone for joining us today. We will see you next week.